Okay, good afternoon all. Today's topic is cystocele. It is simply we can say that as it is one type of hernia that can occur in the woman. So in detail we can go here. That's the figure it has shown. That is the normal the bladder, uterus, urethra, vagina and rectum is present, and how the cystocele, that is the relation between the vagina and the bladder. Vagina and the bladder, there is a relation, that is the cystocele we can call. You see here the bladder picture, here the normal uterus, you can see the bladder figure, and the vagina also. This vagina and the bladder closely related. That condition is called as an cystocele. Cystocele is the name given to hernia-like disorder of women. Cystocele occurs when the wall linking the bladder and the vagina weakens as a result of the bladder sag into the vagina. Cystocele leads to problems such as discomfort, urinary difficulties and stress incontinence. That are the problems which occurs are discomfort, urinary difficulties and stress incontinence. The estrogen hormone produced in the woman's body keeps vaginal muscles strong, but after menopause the production of estrogen is stopped. This estrogen plays a pivotal role for the production of the woman's body and for the keeping the vaginal muscles strong. But when the menopause occurs, this estrogen production has stopped, and then the vaginal muscles become weakened. So the cystocele is most commonly seen. Cystocele is a disorder is also known as prolapsed bladder or fallen bladder. The bladder has shut down, like that way condition is called as the cystocele. This it can be divided into 4 stages: mild, moderate, severe and complete. These stages are degraded on the basis of staging of the bladder into the vagina. How the falling of the bladder into the vagina we can be divided. Then causes. Most common factors related with the cystocele or prolapsed bladder are menopause. We have seen here there only, because of the estrogen production hormone stops and the vaginal mucus layer will be loosened. Then childbirth. Delivery process creates an excess pressure on the vaginal tissue and muscles. The vaginal tissue and muscles supports the woman bladder, but after the childbirth they may become weak. Staining. The multiple causes that may create strain in the growing area. Lifting heavy weights. Long-term huff and constipation, which may damage the muscles of the pelvic floor. Then symptoms. The symptoms of cystocele are visible after the first stage. The most common symptoms are noticing the vagina and bladder are pain in the lower back, dyspareunia, urinary difficulties, pain in the pelvic floor, bladder infection, bleeding, broken tissue, stress incontinence. Then diagnosis of cystocele. A pelvic exam is carried out on the diagnosis of cystocele to the extent to which the bladder has entered the vagina checked through the rest. Then the doctor may also use voiding cystourethrogram to diagnose cystocele. It is a sequence of x-rays that taken during the urination. Cystoscopy is a procedure in which scope is inserted into the woman's abdomen. This test lets urologist see inside the doctor. The doctor may also perform EKG test to diagnose cystocele. EKG, that is electrocardiogram, that's only. Then treatments, medication therapy, surgery are also. Before choosing the treatment, doctor analyzes the patient's general health, age and severity of the condition. Then estrogen replacement therapy. Estrogen is already has seen that due to the estrogen only, also known as the hormone replacement therapy, to reduce the symptoms of cystocele and protect against osteoporosis. Then next is the pessary. A mechanical device known as pessary is placed inside the vagina to hold the sagging bladder in place. However, there is a risk of infection if pessary is not cleaned at regular intervals. Treatments: Kegel's exercise, The Kegel exercise helps to strengthen the vaginal wall and tighten the pelvic floor muscles. Kegel exercises are very effective in the treatment of mild cystocele and there are no side effects associated with it. Then electrical stimulation. A small electrical device is used in the measure that delivers small electrical currents, contraction of muscles strengthen the pelvic muscles. And prolapsed bladder surgery. It is a minor surgery performed to repair and strengthen the bladder. A patient is on general anesthesia during the surgery. Okay, thank you.